Hi everyone, I hope you're all well. I hope you're staying safe. For those who aren't well, whether at home or in hospital, then I hope you get well soon. I've been getting a lot of questions on social media at the moment around symptoms and how to manage those symptoms if they're being told to stay at home. I'm seeing a lot of things at the moment on social media where they're explaining who to speak to if you get COVID-19 or you suspect you have COVID-19, but there's nothing about how to manage particular symptoms when you are stuck at home. So I just thought I'd do a quick video about that. So the first common symptom that people are getting with the COVID-19 is a fever. And what I've noticed over the years is people don't really know how to manage a fever properly. When they see someone shivering or they shiver themselves, they tend to wrap themselves up in a duvet or a blanket because they think they're cold, but they're not. They have a fever, the body is too hot. You need to cool down. So what you need to do, as long as it's practical, you need to strip down, make sure you're taking a lot of cool fluids on board. And if you have no allergies and it's safe to do so, then take the correct dosage of medication such as paracetamol. By taking this, it will help and it will remedy some of those nasty symptoms and discomforts from a fever. What I wouldn't do, what I would say is a big no-no, is filling the bath up with ice cold water, which I've seen done a million times, and throwing yourself in it. It's not going to work. If anything, it's going to be detrimental to your health. So don't do that. So one of the other common symptoms with COVID-19 is a persistent cough. Some people also complain of feeling a bit breathless. Now the breathless is probably a mixture of the two. It's probably the cough, the inflammation, and it's probably just general exertion is causing the breathlessness more because your body's fighting a virus. And that kind of makes sense. So to alleviate some of those symptoms, don't exert yourself too much, common sense. And the second one is when you're home and you're sat there and you feel like you can't sleep because of this breathing problem or the cough is really upsetting you, then consider some household remedies if you have them, and positioning. So sit yourself propped up slightly on the bed, and that will allow full expansion of the chest, and it will allow you to sleep better and breathe better. One of the other common questions I'm getting at present is around vitamins and supplements. And the question is, should I take them? Well, if you have access to in-date vitamin supplements, then take them. Stick to the dosage, don't overdose, and always have them in line with a balanced diet. At present around the world in certain places, patients with COVID-19 are being treated with high-dose vitamin C. Vitamin C is great for immunities, which we all know. So it's always good to have that in your system, whether you're sick or not. So in the meantime, if you do have access, start using them. Vitamin C, vitamin D. But remember, vitamin D can also come from the sun. So if the sun's out, get in it. If you have a fever though, just bear that in mind, because if you're too hot, you don't want to sit in front of the sun, because again, it will make you worse. I hope this has been useful. I hope it's cleared up a few concerns or questions people may have. And if anybody needs any more advice, then just give me a message, drop me a line. But remember, if you feel there's an emergency or it's urgent, then ring 111 or 999. Don't just sit there and pretend it'll all go away if somebody's really suffering. Always use the appropriate pathway, the right way. Don't overdo it with 999 if you don't need 999. Save that for somebody who does. I hope this has helped. Cheers.